I'm Corinne Dykes Johnson, and I'm President and CEO of Network Health, and I've been with the organization just over a year. I would say our focus on innovation is simplicity, which is probably not what you would expect. Our focus is on making sure that it's easy to access care at the right place at the right time. We facilitate relationships between our members and their physicians and their healthcare providers. And it's really about making it easier for our members to get the best care possible in the communities that they live and work in. Healthcare literacy is very important, and it's something that my team shares because with knowledge comes empowerment. And we want to empower our members to understand the healthcare services that they need, how to effectively and appropriately use them, use their benefits, ask the right questions of their healthcare providers and physicians, because we believe that it makes for a more accountable system. Understanding the best ways to do that is really, from our standpoint, a great way for us to support that. Members who tell us the stories about their experiences. For example, the Medicare Advantage member who stood up at one of our member meetings and talked about how one of our nurses accompanied him to a visit because he had a lot of questions and he was struggling with the information that he was getting. Those are the moments that make a difference and, bring a tear to your eye. And it was one of those unexpected moments. But that's the distinction that Network Health brings to the marketplace as to how we support our members. I would say that for somebody like myself who thrives on a dynamic industry, it's a great place for me to be. But what we do is we work on contingency plans, and we literally have both contingency strategic and financial plans. The Affordable Care Act is a perfect example of how it's changing. It's very dynamic. Sometimes it's changing in the year. Last year, we used to get reimbursed for the deductibles, co-insurance, and co-pays under those plans. The last quarter of the year, the federal government discontinued those payments. We expected it. We were poised and we were ready to manage that, and then we built it into our premiums for the next year, just like other carriers that were willing to stay in that market. So, when I bring my team together, when we strategize, when we put our plans together, we look at what our initial plan is, what are the threats to those plans, how do we minimize those threats if possible, and if we can't minimize them, what's an alternative plan? And that's how we're building a strong team, and that's how we're succeeding on our strategies.